We have another question.
Hi, my name is John Trefford. I'm a patient advocate. I think obviously, like you, I've discovered that cancer can be quite an education. I was diagnosed under managed care. I was 66. I'd spent 30 some years developing medical devices, including PET CT and proton therapy. And I knew the only way I would get protons paid for was by going on Medicare. So I applied for Social Security and Medicare. And I started dealing with insurance when I needed it, which was not easy, as you've pointed out. My Medicare application was delayed, and during that delay, I learned of a breakthrough in bladder cancer therapy, which is a combination of antibody drug conjugate and immunotherapy. And I changed my game plan to using that new treatment, which was, I started treatment the week it was approved by the FDA. My first infusion bill was the size of a mortgage. But fortunately, when I was trying to learn about Medicare, I was directed to a Medigap supplement instead of Medicare Advantage. And I was amazed because on my second infusion, I was gingerly approached by a gentleman who said, "Can we talk about payment plans?" And I said, "I guess I don't know what you're saying. My out-of-pocket has been essentially nothing." So there's something well done with Medicare, single payer. I don't know what it is exactly, but clearly my patient experience on Medicare has been completely different than under managed care. Yep. And I know there's rumors about changes coming towards Medicare and other things down the future. So I would certainly encourage the AMA to do what it can to stand behind Medicare and certainly Medicaid. I also am policy advocate on a different front, but it's been a godsend.
Thank you so much for helping patients to navigate the system that is unnecessarily complex. So first of all, thank you. What I would say is that I also appreciate the way that I could help my patients when they had Medicare. Right? Hardly any barriers to doing what I thought was best. Right? The least prior authorization I've ever seen compared to the more commercial insurance in our state and every state. But then Medicare Advantage is where you would have had a problem, big problem. Right? I remember when I did grand rounds at Henry Ford down in Detroit. And as I'm walking back out to my car, in the lobby area, there were some TVs that people were waiting, and there were, regular TV. Every 15 minutes, a commercial for Medicare Advantage. Mm-hmm. Every 15 minutes. And not just, sometimes primetime commercials where it costs a lot of money to take an ad, mm-hmm. right? But why is that? Every patient that signs up, some third party makes a boatload of money because they got one. Right? And then, to save that money, besides the 30% increase in payment that Medicare Advantage gets, the prior authorization. Right? I am so grateful for you that you got this new medicine that was approved in the same way as me, like literally right when you needed it. Couldn't be any closer, because you didn't have to deal with that side of Medicare. So absolutely, we want people to have the access to care that you had, but not the punishment of having had that. Now the majority of Medicare is now in Medicare Advantage. That's a problem, right? So now you are in the minority of people that could have that wonderful perspective on our healthcare system with the word Medicare in it, without the added word of advantage, because it ain't no advantage. The advertisements will tell you otherwise. That's the problem. If I see a Super Bowl Medicare Advantage commercial, I'm going to get ticked.
Dr. Barbara McEnany, former AMA president and one of our ASCO members, affectionately refers to it as Medicare disadvantage.
Yes,
So
that's the more mild way to put it.
That. I will add, ASCO has been very forceful in advocating for the Seniors Act, improving timely healthcare to Seniors Act. We're 4 co-sponsors away from bringing that bill out of the committee, and so we're pushing that.
Yeah, and this wasn't this is the second inning of that attempt, yes. Right? We came really close last time.
So close.
And that's just it. We don't win everything every time, but you got to keep, and Medicare itself is the biggest one. That's multiple years.
Well, and that's the summary here. We're getting close to time, but Thank you so much for sharing your story and for reminding us that we can have all of these treatments that we're talking about up and down these halls, but without access, we cannot truly impact our patients the way we want to. And so we'll keep fighting together.
Yep.
Yeah, no, it's been amazing to be this happy that I got this diagnosis. It seems totally goofy to say. Like if somebody said, you're going to be happy when you get brain cancer, I would be like, dude, you're a moron. But yet that's exactly how I feel. These are the bonus days of my life. And thank you to everybody for making that bonus possible.
And thank you both for sharing.
Thanks so much for having us.
I'll invite our audience to fill out the forms at the end of the session, available on the app. Thank you so much for your attendance.
Thanks. Thank you.